Hi, everyone, and welcome to the webinar. Thanks so much for being here. I'm Sandra Whitehead. I am the current president of SOPHIA, and it's my pleasure to welcome you to the second in our HIA How To series. And this one, pardon me, this one is on the first two uh, phases of HIA on screening and scoping. So let me get my slides up. We have to do a little bit of a switcheroo with the sharing today. It got to be very strange, but it'll just take a second. All right, so you can probably see yourselves on my screen. All right. As I said, welcome. We are SOPHIA. We are an association of folks who and organizations. Our organization provides leadership and promotes excellence in the field of health impact assessment and health and all policies. We also build capacity and create resources for our members. We provide peer mentoring opportunities. We have a peer exchange program, and we try to get out timely information and resources and training to help people who want to participate in or conduct HIAs or work in the health and all policies realm. As I said, I'm Sandra Whitehead. I am the current president of SOPHIA, and it's also my privilege to be a professor of the Sustainable Urban Planning program here at George Washington University in Washington, D.C. We will take questions at the end. I might go a little fast to make sure that we have enough time for questions. We are recording this webinar. We will share the recording with everyone who registered afterwards. But as we're going along, if you have questions, type them into the chat and we'll do facilitated questions at the end. So, pardon me, just to refresh our memory, HIA is really a systematic way of looking at a program, policy, plan, or project and asking, who does this impact? Who will it possibly impact? And to what degree over what period of time? And HIA is structured to not just identify those risks and those hazards, but also to make recommendations to ameliorate negative impacts and accentuate positive impacts. It's really a very flexible process. It has 6 formal phases, but they're iterative and they can be recursive. And I'll talk about that a little bit more. And it's really to help decision makers identify potential impacts, but also to give community groups who are impacted by the process a voice in the recommendations, not just to make them aware of what their risks are, but to co-create recommendations and answers to these risks to help minimize them. So today we're going to talk about screening and scoping, which are really the first 2 phases that set you up for success in your HIA. Screening is where you start. Screening is really intended to decide if the HIA is the tool for this particular decision and if it will provide value in the decision-making process. Sometimes there are processes where there might not be enough time to do an HIA, or maybe health is already a part of the conversation. So these are all questions that we'll explore in screening. But excuse me, so why do you do an HIA? A lot of times HIAs arise out of stakeholder requests, when there's maybe a change in zoning that will impact communities, something like maybe relocating a recycling facility, or perhaps like we are having here in Washington, D.C. right now, they're trying to move our bus facility for school buses and metro buses into a neighborhood that's already overburdened. So a lot of times communities who are in that situation will request an HIA so that they have a formal role in the process. HIAs can also result as part of a regulatory requirement. There are some municipalities and localities that require an examination of health in any kind of environmental impact statement. A lot of times it's and human health as an afterthought, but HIA can be a part of those formal processes. And also as part of public health accreditation. If your health department is going through accreditation, HIA and the HIA frame are eligible activities that will count towards your change mechanisms. So your screening phase, you should clearly identify what the decision is that's under consideration, including understanding the background, the financial context, the political context, any alternatives that are being considered, and really figuring out if HIA is the appropriate tool to bring health into the decision-making process. Sometimes something as simple as a health lens analysis or a informal risk assessment or hazards assessment can really do some of that work for you, and you don't have to do the formal HIA. It depends on some of the factors that are contextual. And there are tools to help you decide if HIA is the right tool. And then considering whether HIA is going to meet the needs of the community to address any health inequities that already exist or that will be created by this policy plan process. I mentioned the screening tools. This is a screening tool done by the University of Wisconsin, and it's a pretty good one. But at its elemental level, what you're deciding in the screening process is whether or not an HIA is appropriate for this situation. If it is, what is your rationale, right, for why it is in this context appropriate? And kind of what you're thinking about in screening is you want to get to a no or no go. Are we going to do the HIA? So in the beginning of screening, you really have to think about, well, what authority do you have to do an HIA? And I mean formal and informal authority. Informal authority could be, I work at the health department, and this community group I've been interfacing with that trust me came and asked me if I would help them do an HIA. Or formal authority is your municipality says that this is part of your regulatory process, or that is a permissible part of something that you could do in your job. So the reason that authority is so important, it speaks to whether or not your recommendations will have force of law, can be enforced, can be pushed, right? If it's in many times HIA is a voluntary process, and our recommendations or suggestions, but they're suggestions with power and data behind them. So thinking about what authority exists, really digging in and defining the decision to be informed, who's making that decision, who's going to implement that decision. And that's what I mean by the secondary decision makers. These are the people who are going to, it might be your city council who are the primary decision makers, but really the people who are the secondary decision makers are the people in the city departments that are going to implement the recommendations or not, as the case may be. So making sure that these people are clearly identified and a role for them in the process is created. What's the historical context in which this decision is taking place? Are you working with a community that's been disenfranchised, that hasn't had a lot of attention paid to its needs, that's already suffering from disproportionate and disparate impacts? What are the factors that are going to influence your ability to work with the community? What are the factors that are going to influence the placement of the HIA in the decision-making process? And then the next piece goes not just to legal authority, but what legal context, especially whenever you're dealing with land use plans, comprehensive plans, or local government or state government processes and regulations. You really have to be careful of the legal context and what decisions have any latitude in them, or what considerations can be made. And this is where it's a good idea to really talk with your local attorney or your health department attorney if you have one. Is health already being considered? No one wants to do a health impact assessment and invest all of their thinking and their love into this process if it's already being talked about in this context of this decision. Is it politically useful and feasible to conduct the HIA? Are the decision makers open to hearing the evidence and open to listening to the community? And you can read the press sometimes and find that out. And is there enough time before the decision needs to be made? Because HIA has to occur before the decision is made. So you need to have your recommendations ready. And there are long-term HIAs that really work with these processes, and there are many HIAs within, but most of the time you really have to focus in on one question that's going to happen at a particular point in time and aim to get your HIA done then. And then maybe this is the first question you should ask is, do you have enough resources, right? Time is a resource, but you also have to think about staffing. You have to think about, what else is on your plate. You have to think about the community's time and their investment, because you don't want to start something that is not going to be useful to the community and allow them to really be invested. So you want to have the HIA done as early in the decision-making process as possible so that it can inform the formulation of the whatever the implementation is, if it's a local law or a local policy or even an internal process. You want to be able to give this input and so it can benefit the formation of the process. And then we talked a little bit about when health is not being considered, or whenever it could benefit community members to have it brought to the table. And another great way to use HIA is when you are already working with a community. The first HIA I ever did was in Midtown community in Daytona Beach, Florida. And we already had a project going with them, which was a PACE project, where we were working with them to have them identify their environmental health concerns and have those addressed. So at HIA, whenever they identified walkability in their community, which had been rent by urban renewal, they wanted an HIA to look at complete streets. So that was the first one we did. So this came directly from them, right? And this is in the ideal world how that would work. Here are the factors that you need to look at during screening, right? The potential for the HIA to provide new and actionable information so that you have that value add, right? Because you want to have that plus of doing the HIA. The level of community and stakeholder interest. You don't want to do an HIA where it's like pulling teeth or you can't get anyone from the community to tell you anything or participate. So really to think about how interested are the impacted community in this. What are the stakeholders' concerns about the potential effects on health and equity? Is it really broad? Is it very narrow? Thinking about those kind of scoping factors, right, as you're thinking about screening. And then the potential for the impacts to really be to address impacts that are avoidable, involuntary, or reversible, right? Like you want to get in there and address things before they become irreversible or catastrophic. And another thing to really think about is what data do you need? And does that data exist? Can you get it? How hard is it to get? How much work will you have to do? Is it focus groups? Is it surveys? Does it exist in a format that you can use? So these are all potential things to consider when you're deciding whether or not to do an HIA. Decision makers sometimes will just flat out say, we're really interested in health, but we don't have time to talk about this, or we don't want to invest in a process right now that delays whatever this project is. So really thinking about is this the right project or the right topic for your project? And being very careful that whenever you decide that you're going to do an HIA, that you have a specific decision. Sometimes clients will come to me and they will say, I would like to do an HIA on the master plan for parks in my community. I'll say, okay, what aspect of the master plan, right? Are you looking at where the parks are, what the amenities are? Are you looking at how the park plan will roll out over time? And they're like, yes, I want to look at all of that. But that's not a specific decision, right? Maybe it's the adoption of a parks plan, or a specific plan for a particular community center, right? These are appropriately narrow topics, but it has to be a project plan policy or project that can be influenced directly. Thinking about time as an asset or a resource, do you really have enough time to do it? And time really plays into scale of HIA, which I'll talk about in the scoping section of the presentation. But thinking about how long from the time that the decision, from now, right, when you decide to do the HIA until the decision is made, do you have enough time to do the kind of HIA you want to do? We talked about politically feasible, but is the decision sufficiently defined to allow you to do an HIA on it? Is it still kind of fuzzy in the minds of the decision makers? And does that data exist? Again, really thinking about what you need. Who's making the decision, really making sure that you're identifying the main decision makers, and targeting them and targeting your messaging about the project and about the implications to them, and making sure that you've got really a good communication plan coming out of screening. So your screening outputs are really, what is your decision to be impacted? It's very clearly defined. Who are the primary and secondary decision makers? Who's your preliminary list of stakeholders, which we always start with the community that's impacted. Your time frame for the decision, which will allow you to build out the resources and the time frame for your HIA, which you will make into a project plan in the in your next section. And really defining the value, having a really good value statement of, this is why we're doing this HIA and this is why it will be beneficial. And if you get to this point and you say, show this to your stakeholders, and you say, this is why we want to do the HIA. And at this point, you decide whether or not you're going to go on. This is your go and no-go decision at the end of screening. And ideally, you will bring this back to your stakeholders, your decision makers, and you'll say, here are, here's what we decided. You'll create a table with those factors, like a screening matrix. They're very easy to make, and share that with your stakeholders and get their input, because this is the beginning of your conversations with them about the HIA. And if everything is clearly defined in their mind at the beginning, then you will have a much easier project. So the second phase is scoping. And really what you're doing in the scoping phase is you are designing your HIA. You are creating your work plan. You are putting all the parameters around the project, including roles and responsibilities. You're identifying what resources you need, whether it's within your organization or with your partners that you're working with. Scoping really is when you're defining the problem. You're creating the problem set, if you will. And you will have your goals of your HIA, your research questions, who's impacted and where, what's the geographical boundaries. Do your literature review to create your health impacts, which would include your baseline conditions. What is the community health look like now before the decision is made, and using that baseline to create a plan in the assessment phase to examine what those impacts are. And making sure in your scoping phase that you've identified your stakeholders and created a stakeholder engagement plan. And of course, your work plan, which is the ultimate outcome of this phase. So one of the things you really got to consider in scoping, and this is a function of time, resources, and how big your HIA question is what scale of HIA are you going to do? Do you want to do a rapid, which is around 6 weeks and doesn't have a lot of stakeholder engagement? That's also referred to as a desktop. Do you want to do an intermediate, which is a bit longer and looks at more health impacts, or comprehensive? Do you have about a year to really dig in with your community members and really examine this before the decision is made? And I have a chart that'll outline what those three kinds of HIAs are in the next slide. But really during scoping, thinking about the available resources, stakeholder capacity, because people feel studied sometimes and you can't overstudy them. You can't keep inviting them to things, right, if they're over capacity. And making sure that we're meeting their needs by making sure that we're able to compensate them for their participation, in my opinion, is very important. And making sure that you've defined your decision-making timelines. So these are the things that will help you decide what is the appropriate scale and help you set your HIA up for success. And really in thinking through your scoping, you need to figure out who you need on your team, what are their roles, who are the other participants, including your funders. You'll want to set up a technical advisory panel of people who are going to be implementing this, or people who are involved in this kind of a decision implementation in other jurisdictions. You always want to have a community advisory group, if at all possible, right? Getting those stakeholders organizing, getting their feedback in a structured way is very important. And then making sure that you have clear goals and anticipated outcomes. Because if you have those, then you can turn those into a framework for your process evaluation for your HIA. So really thinking about your goals, right? The defining the goals will really give you the parameters of your HIA and help you organize your work. And what I usually do whenever I'm doing an HIA is I write my goals and my research questions up on a whiteboard and I keep looking at them. And sometimes I scribble them out and I rewrite them during, sometimes all the way up to the end of the assessment phase, because as you get more information, your goals might change, but it's really important in the beginning to understand what you're doing and to have those kind of guiding principles and objectives, if you will. And you can adjust these as you go. Here's an example of goals from an HIA that I was technical advisor on several years ago. And really they were looking at building this pedestrian bridge over a creek. And their goals were pretty straightforward, right? Promote consideration of health impacts in land use and transportation planning decisions. That was their big overarching goal. And really working to build the relationship between the public health department, the Department of Land Use and Transportation. And one of the great outcomes of HIA can be to build those partnerships, because people who've worked on a project together tend to work on more projects together because you figure it out. And providing an opportunity for community members to give feedback on the design of the bridge and where it was going to be constructed. There were different landing places that the bridge could have gone. So this is one example of some good goals. Here's another one. This is the State Road 50 BRT Transit HIA that was done by the East Central Florida Regional Planning Council in Orlando. And this is what they were wanting to do, right? To understand whether or not the impact of the BRT on the full panoply of the community, right? How it would help them access goods and services, get to jobs and to school, help people who don't have access to cars. I don't know if you've ever been to Orlando. It's very hard to move around without a car. And to help people and to help create economic development opportunities along State Road 50, which is it's one of the main arteries of downtown Orlando. So these are just some examples to give you an idea of what very clear goals for an HIA look like. Making sure that you are clearly defining the range of health issues to be examined. And the way that you will start this is you will look and do a literature review on the connections between your decision that that is being made and the outcomes, the health outcomes, right? What are the health outcomes of reducing auto traffic on State Road 50 by putting more people on the bus, right? What are the health outcomes? And so you can narrow your search down. And what you're going to do with that literature review is you're going to build a pathways diagram. And really thinking and putting a pathways diagram up will show on one side the input, which is it's just a logic model, right? It's the input, which is the decision to be made, and it'll show you the intermediate outcomes. And all the way over here should be your health outcomes all the way to the right. And I'll show you a couple of these in a minute. But so thinking about what the links are between the decisions and the health outcomes, and making sure that you create this tool, this pathways diagram to communicate those and get feedback from your stakeholders. It's, the first draft of this should be shopped around to the decision makers, to the people impacted, to all of your stakeholders, because there are going to be things that they will see as impacts that will be impacts that aren't going to show up in your literature review. They're not going to be something that you as a researcher or you as an outside person who doesn't live in this community thought of. So making sure that we are getting that direct feedback, especially at this formative stage, and making sure that there's you're thinking about disproportionate burden. You're thinking about the burden that already exists on this community as you're creating your baseline conditions, right? Don't just look at the sex, race, ethnicity of the community. Look at their health outcomes that they already have. Maybe something is higher or lower, something that would be exacerbated that's already a burden to them. Look at what other stressors are occurring in the community so that you can separate the impacts out of the decision from the burden that the community is already carrying. And this is that nexus where health impact assessment and cumulative health and cumulative impact assessment really touch. The geographic boundaries depends on what you're doing, right? Air is not contained in your county boundaries, right? Water flows downhill and it will go where it goes, right? So thinking about those media in whatever your decision, right? If you're talking about air quality improvement from putting a bus on the road instead of a bunch of cars, you have to think about what's the airshed and how do you model that? Work with your partners. There are lots of great online tools. NOAA has online tools. Your pollution control agency might have online tools, but figure out how to map out your geographic boundaries. And is the impact differential based on where people are? If you're looking at road pollution, then your impact is going to be different if you live right on the highway than if you live 3 blocks in from the highway. So really thinking about your geography in terms of your decision. And you can see this is from the HIA that we did in Pinellas Park, looking at their brownfields assessment policy. And this was the caption area where all the brownfields were. So that was our geographic boundary. The scalability, I talked a little bit at the beginning about different kinds of HIAs. There's really 4 kinds because I consider desk-based and rapid a little different. A rapid can be done in 4 or 5 weeks. I've seen a rapid done in 3 months, and a rapid can include folks participating. Desk-based usually does not. It's a lot more limited to what you can find online or through journal articles or even other HIAs, which is one of the tricks I use a lot. But if you have more time, right? And you can do an intermediate, you can do a deeper dive and look at 3 to 10 impacts and really look at them in detail and collect some primary data from your stakeholders. That, it gives you a much bigger picture. And a comprehensive, the same thing. It's just more time and more detail that you can get into with your community. And a lot of times when you're doing a comprehensive, that is when you can most dive into more quantitative types of data. And if you want to know more about that, come to our later data in HIA webinar. But really what you're doing is you're defining the limits of the HIA, right? Who's impacted? Are there people who are more impacted than others? What is the baseline that folks are dealing with in terms of their health and their environmental stressors or their financial and social stressors? And based on those answers, who do you invite to the process? And furthermore, thinking about not just who needs to be at the table, but at what point in the HIA process do they need to be there? And are you going to have them be fully involved? Are you going to consult them periodically? Or are they just going to be people who get informed about the process? So really thinking through your community engagement plan at this point in time in the HIA, I think is really key to making sure that the right people are at the table, at least to begin with, until you can snowball and find more people who might be interested, right? Never think that your first set of stakeholders is going to be your final set of stakeholders, because as you get more interest and people tell other people about the project, more people might want to be involved. And that's perfectly wonderful, right? You want more people involved. And really thinking about too in this engagement plan, how do you promote and sustain participation? What techniques do you use to make people not just get to the meeting, feel like they're really being heard, to feel like that you are using their input? What feedback mechanism do you have to loop back to them and say, this is what we did with your input, and here it is right here in the logic model, right? Showing people that, I think, is really important. And making sure that you're going back and looking at this periodically. Because the community engagement, it exemplifies the equity and the democracy parts of HIA. Those are our values of HIA. And really having people's voices, people who are impacted by these decisions, be at the table. If you're not doing things with people, you're doing things to them. So making sure that they are identifying equity issues, they are bringing health issues to the table, right? Just because we did a study doesn't mean we know the answers. Increasing the transparency of the project is another reason to do community engagement, right? Making sure that people know what you're doing. You're not just knocking on the door and extracting things from them. And it helps you to ground truth your findings, right? I did a study one time, a literature review, and I went back to the community and I said, here are your health problems. They're like, oh no, we don't have that problem because the wind blows in from the west, and this is not a problem for us. This is a problem for the people on the other side of the highway. It was like, I would never have known that. I would have been completely wrong in my predictions. So really thinking about how do you not just get people involved, but invested, because that's how you're going to get the best HIA. That's how you're going to get the best recommendations that really respond to their needs. And it also gives you support. The final HIA report that went to the Daytona Beach City Commissioners, I didn't give that report at the City Commission meeting. The chair of the Midtown Heat, she gave that report. She made those recommendations, and they owned that. They took that HIA and every one of those recommendations, they went to a city council meeting and pushed for those things to happen. So that's like, in my mind, that's where you want to be. You want the stakeholders to own the process. And making sure that whenever you're thinking about your engagement plan, that you've mapped out your stakeholders. You don't have to do a formal network analysis. You can look at their website and see who's connected to whom, what organizations are working in this community that you might not be aware of. Do a snowball sample. Ask the people who are already involved, who else should we bring to this process and where do you think they fit? And making sure, as I said, when and how people need to be involved and at what level of engagement. Um, this is a project that I worked with oh gosh, I don't even remember this one. So long ago. But as you can see, right, it doesn't matter where you meet with people as long as you meet them where they are, meet them in their community. Don't ask people to come to City Hall or a cramped building in the basement of the courthouse, right? Go to them. This is a structured way to look at identifying your stakeholders. And whenever I do this exercise with communities, I have a spreadsheet for them, and it's primary stakeholders, secondary stakeholders, and we map it. And sometimes we map it like this, on this other side, right? There's a lot of different ways to do the stakeholder analysis, but just making sure that it's not the researcher sitting in a room doing it alone. These are examples of folks that you'll want to have involved, and as you're thinking about your engagement plan. I mentioned different roles for stakeholders. One I didn't talk about was HIA Community Champion, right? They could just be the person that goes around telling their neighbors that this is a great project and they should talk to the people who are doing it, right? There's lots of ways to involve community. Your pathway diagram, I mentioned, this is how you are showing your causal pathway from your decision to your health outcomes. And it's a way to organize what is known about the impacts and to show your theory of change over time. And, it's correlation, not causality. Right. And so in public health, it's always tricky to say, well, this causes that, because our health is so multifactorial. Just being clear about that and using, dotted lines. And whenever you use this, it's just a tool, right, to talk to the community. But I find it helps me organize my thoughts as well. Here's an example of one from decreasing speed limits. And you can see my students did this one. Just kind of the outcomes that they identified. And then, you also have to think about, as you're working towards your HIA work plan, what skill sets do you need? What assets do you have? Do you have data sets? Do you have a GIS capability to make heat maps? And, do you have an EPI on your team? Do you have a community engagement person? That's a specific set of skills. And I find that if you have a person on your team who specializes in that, it's much better because they've spent a lot more time thinking about those kinds of things. And these are the elements that you should have in your HIA work plan. I'm not going to go over all of them because we are going to share the slides with you, but a lot of these are things that came out of your scoping, right? I mean, your early scoping steps, the potential data types and sources of evidence, methods to answer each of your research questions, a narrowed list of potential health and equity impacts that will focus on, sort of, and explain your rationale, right? How'd you come up with these impacts? Where did they come from? You'll have your baseline health data in your work plan, right? That'll be coming up. How are you going to approach the evaluation and characterization? And you don't have to know, because you'll figure out all the details of that in the assessment phase, but you should have a general idea of how you're going to approach it at this point. And if there are gaps, if there is data that you're going to need that doesn't exist, some kind of way of either thinking about how to get that data or a rationale for why you didn't do it. Sometimes it's prohibitively expensive. I was working on a lead project one time, and the CDC wanted us to take hair samples from people. And I said, that's great. I can take all the hair samples in the world, but I don't have any money for the lab to analyze them. Right. So thinking about what's feasible, and that would have been like the ideal way to test whether our intervention worked, but that's, not what we had money for. And making sure that your your work plan is available for everyone to look at and that you share it. It doesn't have to be like a special meeting about the work plan, but just making sure all of your stakeholders have seen it. They understand the process. They know where you're going and what you're going to be doing, because a lot of times they'll insert themselves in places you didn't think that they would be interested in being, right? And making sure that you have a plan for communicating and reporting your progress and disseminating your findings before you get to the reporting phase, right? You want to make sure that you're thinking about social, you're thinking about letters to the editor or one pagers or a text chain that you can have your stakeholders on, or whatever those things are, those communication pathways are that are most appropriate to the folks that you're working with. And your partners will tell you. Make sure that your work plan clearly identifies tasks, responsible parties, when that's supposed to be done, and how that moves the project along. What's the expected outcome, right? Is it that, at the end of this process, we're going to have a draft community engagement plan? Check. Sandra's in charge of that, right? And making sure that you're looking back at your work plan as you're going through the process. It's easy to get lost in the details, especially whenever you're like me and you want to do as much community engagement as possible. Sometimes you just have to stop collaborating with people and start writing. And this will help ensure that you get done on time, that you meet your goals, and it helps you operationalize the process of HIA. It makes it more real. So in summary, whenever you get finished with the scoping phase, you should have your goals, your process, and your participants clearly defined. You should have your stakeholder involvement process set up, and you should also have your sketch of your evaluation, your process evaluation. You'll know what data that you need. You'll understand who the impacted communities are and the parameters and the structure of the HIA, and help provide your stakeholders each with an entry point into the process so they understand where they fit, how they can be impactful, and how their feedback is used. And really thinking about how scoping prepares your team for the assessment phase, because this is when you're going to drill down into predicting impacts. So I'm going to stop there, stop sharing my screen, and remind me to put these back up at the end so that you have the resources and the next webinar dates. But I wanted to stop sharing and see if there are questions at this point.
I haven't seen any come in through the chat. Does anyone have any questions? You could type it out or just unmute and ask.
Well, I'll ask a question then. Show of hands, how many of you have done an HIA so far? Oh, not yet. Two people, great. Three, yay. In your experience, folks who have done this, did you do all of those things that I just talked about? Because all of those things I just talked about are straight out of the MEPS, the Minimum Elements and Practice Standards. Yep, I'm seeing one person did those. Let's see. Yeah, Catherine, this is a sticking point. And for me, compensating community members is so important, right? Like, we ask people to come to so many things and to give us feedback, and it's our job. We're getting paid to be there, right? But we have to consider that they're giving up their time, right? And early, as a working planner, whenever I was first starting out, one of the things that we made sure that we were doing is we were providing daycare for our night meetings. We were feeding people dinner, because our federal grants would not pay us to give people a stipend to participate. That has recently changed. If you have any EPA money, you can definitely compensate community members. And what that generally looks like is you can hire them to be part of the HIA team if you have money, right? I have hired community members to be my community engagement coordinator, right? They know everybody in the community. People will answer the door whenever they knock on the door. But I found somebody that lived there that needed, experience and was a great organizer. Turned out they had all of these skills that they, just had never been paid to use. So that's one way. Build that into your budget. But I think another way that we were able to get around that when I was at the state health department was that we got grocery cards for people. So, I mean, it's not perfect and it's not cash money, but I was able to get, one of the grocery store chains based in Florida to donate, like $1,800 worth of grocery cards. And it wasn't very much, but it helped people be able to be there. The most recent project that I worked on, I built into the budget $5,000 for the community coordinator, and this person doesn't really have to. They're not organizing meetings or anything. They're just getting people to the meeting, and they're also carrying our message about the project into the community. So I think that's well worth it. And the other thing that we were able to do, because this is EPA funded, we were able to get stipends for each of our community advisory members, right? So I was like $400, $500. It's not a lot. And they're giving me, I tease them that, I'm paying their two cents an hour or something, but at least they're getting something. We're getting there, right? It's an equity issue, right? I'm being paid to be there. Why aren't they? Yeah. Other questions, comments? Has anyone else been able to pay community members to participate? No? It's a sticky wicket. It's hard, right? Especially if you're using federal dollars or even state dollars that, are attached to federal money. It's especially in chronic disease, we couldn't do it at all whenever I was over there. Well, if there aren't tons of other questions, let me see if I can get back to my slides. And I will just share, we have some upcoming webinars. We'll do that weird share thing for a second. Get back to my slides. We have on July 13th, I'm going to talk about the assessment phase. So this is the next one in our HIA How To series. In August, I have not confirmed the date, but Dr. Ben Polly from Kettering University is going to talk about how to use community voices as evidence in HIA. Ben's at Kettering and he's worked on the Flint issue. He's a member of the Michigan Water Council. And we also have another webinar that's coming up in August on the HIAP, the Future of HIAP Roadmap that was done by Onside Partners as part of the closeout of the Health Impact Project. And they'll be joining us at some point in August. We'll send those dates out. And in September, I'm really excited. Christine Ortiz-Gumina from NNPHI is going to talk to us about the Health and All Policies Guide to Preparedness, which she worked on whenever she was at the National Environmental Health Association. So if you're liking our webinars, if you're enjoying our community, please join SOPHIA. It's not very expensive. We have some really great benefits to being a member. These webinars, but we also have work groups that you can join. Our Health and All Policies work group is going to be doing a webinar on their new screening tools and their one-pagers on their screening tools that they're finishing up. So we have a lot of really great and interesting things going on. We'll have a virtual practitioner workshop in December. And then we just confirmed that in the spring, we're going to be having an in-person workshop here in Washington, D.C. So more about that, watch our website, join SOPHIA to get all of the updates. Here are some resources on these slides, which you'll be getting. And that is a wrap, folks. Thank you all so much for joining us today. Let's see if I can get back to my screen. If you have any questions about anything you saw today or about the HIA process in general, feel free to contact us here at SOPHIA. And I hope you all joined. It was great to see you.
Thanks, everyone. Thanks, Sandra.